Hello, how are you? And those who are new here, my name is Winnie Barawa and I coordinate Medic Academy, and we are currently on a series learning more about nursing care plans and the different aspects of it that you need to know as a student and as a nursing professional. So in today's class, we are going to look at components of a nursing care plan. And in these components, we'll look at what makes a nursing care plan or what basic parts compose of a nursing care plan. So these are the basic components: the assessment, diagnosis, expected outcomes, interventions, and lastly, the rationale and evaluation. So these are the backbone of what makes a nursing care plan. But we'll go step by step so that we understand what composes of all these components, so that if you'll be going on to generate that nursing care plan, you'll be able to have a clear picture of what you are expecting to do in all of it. The first part of the components of nursing care plan is the assessment. Now, most of the people, when they hear assessment, they just think of only the physical examination. This is not the only thing you do when you've been asked to do assessment or what this component entails. It entails more than the physical examination. It entails looking deeper into getting as much data and as much information about your patient, because we will use this information to move to the next component, which is nursing diagnosis. But first, when you're handling this assessment part, you need to be as exhaustive as possible and explore as many avenues as possible that can give you data and information concerning your patient. Like, do not just dwell on the aspect of physical examining this patient and making it the last portion of it. You have to look at more things, check onto those medical records, see what was done in the lab, what was the lab results, check into those assessments that were done around, let's say, CT scan, x-rays, and diagnostic reports, what was done in the radiology department. Get to analyze and get data that comes from those sides. Again, explore with your patient, including information that you got during history taking. Look at information, even the one that you got while this patient was just talking to you randomly. All that information is key, because it will help you to actually get a broader analysis of your patient. But now, when you're assessing, remember we are looking at so many parts of this patient, and number one of it is looking at one physical here. All right, let me get my pen so that I can highlight this. So number one, look at the physical here. Okay, explore areas around the emotional state of this patient. This is part of mental and emotional balance for your patient. Explore sexual, psychosocial, explore areas around their culture and beliefs, spiritual, cognitive, age-related complications, economic and even environmental issues. So all these are key areas that you will need, that will give you enough information that can be used to generate a care plan. And the information you generate can be what we call subjective and objective data. So what do we mean by subjective? Subjective is what the patient will tell you. So if they tell you, yesterday when I went to the toilet, I realized my urine is this way. That is subjective. That is what they are reporting to you. It does not have any medical background in it. But now, when you're looking at that data in an objective way, so objective way is your view as a nurse who has the medical knowledge in this aspect. So as a nurse now, you will be able to analyze that subjective information based on the objective knowledge that you have. So you can say, okay, if the urine was looking like that, then what does it mean? So you can say, okay, could they be having an infection? Could it be meaning there's an injury in the bladder or anything? So you relate to it objectively now. So those are areas you need to know. Assessment. The next part is nursing diagnosis, the biggest elephant for most people. So the nursing diagnosis is simply a statement that describes the patient health issue or concerns. And again, a nursing diagnosis is highly supported by the physical examination that you'll have done on your patient or the assessment that you'll have done on your patient. So mostly the nursing diagnosis is spread out, and the beauty of it is that in nursing there is what we commonly call NANDA. So the NANDA is a guiding source of nursing diagnosis for nurses. So if you're still struggling out there and you really wish to master your nursing diagnosis, I'll advise you to start with NANDA, nursing diagnosis booklet. If it's too concise, because some people feel the NANDA is too concise, like it's too not elaborate, you can still explore other books that highlight on nursing diagnosis. I love that currently there are so many books out there that highlight this nursing diagnosis. They give even examples and they show you how to relate the stem that you've come up with, and it's just good. But just know the nursing diagnosis, it's a statement. We will come out to generate this nursing diagnosis, but it's just a statement that will describe the patient health issue or concern in such a way that it shows the pathophysiology aspect of that patient issue, the relationship around it, and the evidence that proves that that issue is of huge concern. And so after doing your nursing diagnosis, the next aspect is generating expected outcome, goals, or rather what you call the plans. So outcomes, goals, and plans, this is a step on the nursing care plan that will specify the goals that will be achieved through the nursing interventions. So the nursing diagnosis can be long or short term. And long, we mean things that can take weeks or even months. Those are long-term goals. Short-term goals, so most of the time we refer to the goal that you hope to achieve while you're administering this nursing care plan in that particular shift or within 24 hours. Those are our short-term. They don't take long time. They can achieve within a day, or if it has to go, maybe a few days, but not spill into weeks. So expected outcome simply will be showing us what goals are you expecting to achieve as you administer these particular nursing care plans. And so while you have done your goal, the next thing is to intervene, and this category we call it the nursing interventions, or the step where we are intervening on our particular patient. So the nursing interventions are specific actions that will be taken to address the nursing diagnosis and achieve the expected outcome. So when you're putting out there your nursing interventions, you need to have mastered your assessment, you need to have mastered your goal and why you want to achieve at the particular end of time of your care. And these nursing interventions, you need also to come and give a rationale, like why are you administering that particular drug. So that's why I will refer back to where we say the nursing care plan brings a state of independence on the nurse, because the nurse will not just administer a medication based on a blind care. They need to understand why that drug was administered, why they have selected that particular drug, and the nurse is also allowed to actually interject in case they feel that drug may have an effect or may have bad effect on the patient, or what called side effects or consequences that may be of detrimental to the patient. So the interventions here is where now you bring in the reasoning on evidence-based and explanations on why you're giving that particular intervention. If you evaluate and see that the intervention may not be appropriate, then you are allowed to nullify and interject on that. You don't go ahead and give management that is risky and can risk death to your patient. And lastly, part of the nursing care plan is evaluation. Evaluation, or rather, this includes the level where we are now monitoring and evaluating the patient progress. And at this level, you're also allowed to evaluate and adjust. So if you look at the nursing care plan and you realize this patient has not achieved the goal I was looking for. Like if you have administered antipyretics and you wanted to reduce the temperature, let's say from 39 degrees Celsius, and your target was to have your patient go down to 36, but you keep realizing even if you've given your medication, these temperatures keep rising and they keep going up, and it's not bringing in the outcome you're expecting. At evaluation level, you are allowed to consult with your doctor and agree, do we change the medication or what do we do? Because now you are the one who is on the ground administering these interventions. So what we need to do is now to reason around and see, is the nursing care plan meeting the goal, or are the interventions meeting the goals? If they're not meeting the goals after monitoring and evaluating, then as a nurse, you are allowed to adjust, seek consultation, and get the patient care evaluated better. Yeah, and this is a summarized process. So simply, the nursing care plan has five components here. And this is assessment, and this is where we are collecting as much data as possible around our patient. We have the diagnosis, or rather, what is the problem that our patient is going through. Planning. So planning is where the goal is, and implementation. So implementation is where now we are putting the interventions and the rationale and why. And lastly, we evaluate, or rather we finalize on, are we meeting the goals, or do we have to adjust the care? So I hope you keep enjoying this class and you feel like this is now starting to make sense. So like I said, this agenda of this series is to demystify the myth around nursing care plans and how people feel it's a difficult area. It's not difficult, it's doable if you simplify it and just spend a little time on that area and master your art. So again, if you enjoy our work, kindly click that subscribe button and the notification bell so that when I post the next video around the nursing care plan series, you are able to see and just come around and get to learn more about them. Thank you very much and see you in the next class. Bye bye.